us, and I'm going to now turn it over to Carolina Reed. Carolina is the faculty research advisor at the Turner Center for Housing Innovation and an associate professor in the Department of City and Urban Planning. Her research focuses on access to affordable housing for low income and households of color. And she is going to moderate our next panel, which will focus on the pressing challenges of homelessness in California. Thanks very much.
Thank you, Liam, and thanks to that first panel. That was terrific and really set up our panel nicely. First, I'd like to just thank Joe and Hillary for inviting me to be here today. I'm going to be providing some overview remarks to situate the homelessness crisis in context here in the Bay Area. And then I'm joined by two amazing panelists, Tamika Moss, the founder and chief executive of All Home, and Janie Roundtree, the founding executive director of the California Policy Lab at UCLA. Unfortunately, Emily Cohen, who is on deck to join us from San Francisco, had a last-minute emergency and so won't be joining us. So it's just going to be me, Tamika, and Janie holding forth, but I think we'll have plenty to talk about. The way our panel is going to be structured, I'm going to start off with some slides that set the context. And then I'm going to ask Tamika and Janie to both introduce themselves and also give us a little bit of context about their organizations and the work that they do in the homelessness space. I'm going to ask some questions. As per Liam earlier, I'm going to try on my Terry Gross hat and see if I can extract some interesting conversation with some questions. But then we're going to open it up to the audience. So please, if you are in the audience and would like to ask questions of this panel, just start putting them in the Q&A box. You can also upvote questions. So put the little thumbs up if you want to make sure that that question reaches to the top and we address it. I'm going to take a minute here and just share my slide. It's not going to be a surprise to anybody who's interested, who's participating today, right, that the data show a pretty dramatic increase in the number of people who are experiencing homelessness in the Bay Area. These data are from point-in-time estimates. We know that they are a dramatic undercount of how many people are actually experiencing homelessness in the Bay Area. And they show that more than 35,000 individuals in 2019 were unhoused. It is likely that COVID is going to lead to higher rates of homelessness going forward. It is certainly going to lead to higher rates of people experiencing housing insecurity. And even if they don't end up long-term on the street, that housing insecurity has significant consequences both for children and their well-being as well as adults. It has impacts on their labor market attachment. It has impacts on all sorts of things that really matter to households, to communities, and to cities. 70% of extremely low-income renters, these are renters who earn less than 30% of the area median, have had income losses because of COVID, and they are both more likely to report being behind on rent and also concerned about eviction in the coming month. Certainly, the recent federal package, as well as the rent relief efforts at the state level that Senator Wiener was talking about in the previous panel, are a really welcome development. But that money is going to be spent quickly. It's not going to reach far enough, or certainly not reach the most structurally vulnerable households. And especially given uncertainty about which jobs are going to come back, when they're going to come back, how much rent debt has accumulated over time, and or credit card debt, we're expecting that especially extremely low income families in the Bay Area are going to be facing increased housing precarity. Why am I focused on ELI renters? The reason our homelessness numbers are so high are in part because we have a steady inflow of new families and new individuals into homelessness. We have in the Bay Area about 400,000 ELI households. About 68% of those are renters. That's 800,000 individuals. Their annual income is less than $17,000. This means that they're surviving on about $1,400 a month and can afford a rent of about $475. And I think in the earlier panel, we heard about the prices of rents dropping in San Francisco, and now they're down to just 2,700. But that is well above what an ELI renter can afford. This is also a racial equity issue. I think Sarah said that really well in the previous panel. But about 30% of the Bay Area's Black and African American households are ELI, nearly 3 times that of non-Hispanic white households. This is the key thing to remember, is that the reason we have such a high homelessness problem in the Bay Area is because our housing policies are largely failing extremely low-income renters. Only about 15% of ELI renters in the Bay Area receive some form of housing assistance. So unlike food stamps, unlike other programs that we have to support people with basic needs, housing assistance is not a right, and it reaches only a very small share of people who are eligible for that assistance. We have an additional about 25% of ELI renters that live in a 35% live in a rent-controlled unit. That offers some sort of protections. However, in most cases, that mean rent is still not affordable in the classic sense that it's only about 30% of that family's income. The median rent right now of rent-controlled units in the Bay Area is about $1,200. 50%, or about 130,000 households, have no subsidy and are not protected by rent control. And so these families are literally just one financial shock away from housing insecurity and the likelihood or the risk of becoming unhoused. What's needed? What's important? One, right, we just have such a significant mismatch between the demand for housing and the supply in the Bay Area. And this mismatch has led to a significant shifting in Bay Area housing rents, where we're seeing increasingly more units renting for above $1,500 a month and a dramatic loss of units renting for less than $1,500 a month. At that less than $500 level, we don't see as big a decline, and that's because most of those are protected by some kind of housing subsidy, so they are deed-restricted affordable housing. But as you can see, we've lost significant numbers of units in that $500 to $1,500 level. So what's needed? First, right, homelessness is expensive. And we talk about, oh, it's going to be so expensive to provide housing subsidies for people. But providing direct housing subsidies, providing direct income supports is actually a very cost-effective way of preventing homelessness or providing housing security for families who are experiencing housing insecurity. This is just research from one study that was done by HUD. It's called the Family Options Study. And what they did is they sort of did an experimental design where they tracked families who were sort of prioritized for different housing interventions, and then compared the outcomes of those interventions against sort of a cases of everything as usual, which means that these people experienced housing insecurity and homelessness. And the results of the study showed that those that received a housing subsidy had much better outcomes versus the control. So those are the people who are just going through the homelessness system as usual, had much better outcomes in terms of staying housed, staying employed, and food security than those who did not. The next thing we need, and I think the previous panel spoke about this well, so I'm not going to belabor the point too much, but we need to expand the supply of housing. This is data from the last RHNA cycle. So the previous panel was talking about the next RHNA cycle, which is going to expand the number of units that cities need to plan for. But when we look at the last RHNA cycle, we see that overall, a lot of the counties in the Bay Area are doing a good job of meeting their RHNA targets for the above moderate income rental needs or housing unit needs. We are falling very, very far below the needs for extremely low, very low, and low income families. And so it's not just, as Enrico said, about where we're building, but also at what affordability level we are building in order to reach those units that could be affordable to ELI households. The last piece of the puzzle is we also need to improve labor market outcomes and build the economic mobility pathways. Almost half of ELI households at greatest risk of homelessness are employed, and they're working in jobs that provide critical services, from health and social service workers to food service and custodial work. But these low-tier jobs have seen very few wage gains over time. And we are not seeing enough growth in these middle-tier jobs that build up and provide a platform for economic mobility. It's an ambitious agenda, right? It's tackling some of our biggest problems in both housing and labor markets, but without focusing on this prevention piece and without focusing on the housing insecurity of people who are currently housed, we're going to see a continued pipeline into homelessness, and all of the amazing efforts that are underway to address those that are currently unhoused are going to constantly be playing catch up. It's ambitious agendas. It's going to take policymakers, practitioners, and researchers to come together to figure out how to do all of this. And I am certainly joined with some of the best minds in this regard. And so I'm really excited to introduce my fellow panelists, though it looks like Tamika might not quite be here yet. Let's see if that's true. I've got Janie here. Hi, Janie.
I'm here. Hi.
Awesome. So, so I'm going to turn it. Oh, sorry. I'm going to turn it over to you first. And if you wouldn't mind introducing yourself and telling us a little bit about the work that you do at California Policy Lab, that would be terrific.
Yeah, I'd be happy to. And I don't have slides. I hope that's okay.
Absolutely.
But thank you so much for inviting me. I'll just speak briefly about the California Policy Lab, and then I'll provide some insight, I think, into homelessness, particularly with a focus on Los Angeles. As you and others have already mentioned, I'm the founding executive director of the California Policy Lab's site at UCLA. We have sites at both UCLA and Berkeley. And the California Policy Lab is about 4 years old now, and we have a mission to improve the lives of Californians through rigorous research and research partnerships, primarily with public agencies. We work across 5 issue areas, which is very intentional. So we work on homelessness, which is probably our largest research portfolio at UCLA. We also work a lot on labor and workforce development, education, criminal justice reform, poverty and the social safety net, and education. And that's very intentional because if you think about a person, they are impacted by all of these systems. And so thinking about any of them in silos really doesn't help us understand an issue like homelessness, for example. It's deeply impacted by choices that we make around incarceration, labor market and workforce issues, as well as homeless services. So what the California Policy Lab does is we set up research partnerships with public agencies, we develop research agendas, and we really specialize in linking administrative data and really trying to mine data for insights to improve programs and their effectiveness and to help policymakers make decisions. We have about a dozen research partnerships with agencies working on homelessness, primarily in Los Angeles, but also in the Bay Area. And I'm going to talk a little bit about what we're observing about homelessness in LA and a couple of our research findings, and then I'll leave the rest to Q&A. So one of the things that we've done over the last few years in Los Angeles is knit together a linked data set that allows us to see the homeless population, not just through the data on who is getting homeless services, but also who is homeless from the point of view of safety net programs like food stamps or CalFresh, TANF, which is called CalWorks, the General Relief Program. We can see homeless individuals that are flagged by our hospital system, by our mental health department. We see substance use treatment data. We can also see when people enter and exit the LA County Jail or on probation. And it's given us a much more holistic view of what's happening to homeless individuals in Los Angeles. You might be familiar with the point in time count. That's a snapshot of the size of the homeless population that's taken by volunteers, typically one night in January. It was canceled this year due to the pandemic. The last time there was a point in time count in LA, there was an estimated 66,000 homeless individuals who are visibly homeless or in shelters. When we look at our data, though, we're finding unique individuals over the course of a year. Obviously, not everyone is homeless on the same night in the same month every year, right? So there's a lot of inflow and exiting to homelessness. And we actually think the true number or annual count is probably closer to 140 or 150,000 unique individuals who are experiencing homelessness in Los Angeles in a given year. A lot of people ask, are they really from California? Are they from our community? There's I think a myth that people come to California to be homeless. In fact, at least 82% of our homeless population is coming from Los Angeles. They're from California. And that's further supported by research that we did linking homeless services data to state wage records, where we saw 75% of people enrolled in homeless services actually have an employment record in the state of California. This makes sense. People aren't traveling long distances when they have no means of supporting themselves and they're really in distress. So I think that's an important thing to know. I'm going to talk a little bit about our work to understand the intersection of homelessness and serious mental illness. I think that one thing that's helpful to know is that when we're looking at the people first entering homeless services in Los Angeles, so they have no record of seeking homeless services before they're showing up, they're seeking assistance. We linked that data to our Department of Mental Health clinical data. Only 10% of those people have any record of receiving public mental health services in Los Angeles. That number gets much, much bigger the longer people are homeless. So we look at our population that's been on the street, in some cases, many, many years. Then you see 25% of that population has a record of receiving public mental health services. And 20% specifically have a diagnosis of a serious mental illness. And I want to pause here to say that that's a lower bound estimate because we were relying on clinical diagnoses. Obviously, there could be people who are not diagnosed yet or who were diagnosed in a setting other than a Department of Mental Health clinic. But the point I'm trying to make is that homelessness is not primarily caused by serious mental illness. There are many people suffering from serious mental illness who never become homeless. It is being homeless that exacerbates and causes serious mental illness. The fact that we leave people unsheltered and untreated on our streets and the issues that come with that. But also, I think it's important to understand that homelessness is primarily driven by poverty, and there's been so much data on the panel that I don't feel like I need to really go into much more detail. But it's the lack of economic resources paired with an unexpected financial crisis or a diagnosis that really puts someone at risk of homelessness. I wanted to also talk a little bit about work we've been doing to study race equity and homelessness. The Black population in Los Angeles is about 9% of our general population and about 33% of our homeless population. We supported a community effort called the Ad Hoc Committee on Black People Experiencing Homelessness with data and research. It's a fascinating and really groundbreaking and important report that's available online that had 40 or 50 stakeholders contribute a number of analyses. But one of the things that we found is that when clients are enrolled in permanent supportive housing in Los Angeles, which is the key intervention for homelessness, you're actually given a subsidized housing unit. Black clients were 40% more likely to return to homelessness than white clients. And that's a figure that we've really analyzed using a number of different statistical methods to try to isolate the effect of race on that outcome. And it's really troubling. And we did a follow-up research project to really examine why. Why is that happening? And we conducted interviews and focus groups in addition to more data analysis. And this story really emerged that the reasons are both structural and individual. There's a structural racism happening where Black clients in Los Angeles are routinely accessing lower quality permanent supportive housing, housing that feels more temporary in nature than other types of housing in the county. And there is a history, I think, of disinvestment in community-based services and the nonprofits that we rely on to deliver homeless services. And so we're hearing a lot of information around access to caseworkers, the ability to hire caseworkers, how frequently those people can meet with clients who are in permanent supportive housing. And then apart from the structural issues, we were also hearing about individual racism and housing discrimination, either by landlords or even in some cases by case managers. We'll be able to produce that report in the next couple of months. We're just wrapping up the analysis, but I wanted to mention that here, that I think I'm the fourth or fifth person to really emphasize that homelessness and housing is really a story of race equity. And I think we need to continue to think about it through that lens and work with our diverse research partners to understand that better. The last thing I'll say before turning it over to Tamika is that at the California Policy Lab, we probably spent most of our time the last few years trying to understand inflows. So who is entering homelessness? Why? What prevention strategies work? I think there is some hope here. We've seen multiple research studies support the idea that one-time low amounts of cash assistance can stop a person or an individual or family's trajectory into homelessness. And so that's a hugely cost-effective strategy. If you can help someone out of a financial crisis and avoid having to shelter them or subsidize their housing, that's obviously a very good outcome. The challenge with prevention is that it's very hard to target. When you look at the homeless population, let's just take families for a second. Some of the things that are risk factors for homelessness are being a single parent, having very low income, having more than one child under the age of 5. These are not characteristics that are helpful in distinguishing the very tiny percentage of families who are extremely low income who will actually become homeless. And so I think public funders, whether it's in Sacramento or at the county or city level, are reluctant to make big investments in prevention because they worry that it will go out to everyone and the effects will dissipate, really, and there won't be any reduction in inflows to homelessness. To give you a sense of the math problem that we're dealing with here, there are 2 million single adults living in LA County who are very low income and are receiving public assistance, and less than 1% of them will fall into homelessness. So you really have to have a strategy for understanding who's at risk. We're approaching that math problem in 2 different ways. One way, we're using advances in machine learning and data science to try to predict current county clients and who's at risk of falling into homelessness. We're doing that with the Department of Health Services and Department of Mental Health for single adults. And then we have a separate prediction project that we're doing for families, where the main partner is the CalWorks program, the temporary aid for needy families called CalWorks here. So I'd be happy to talk more about that if people are interested. The last thing I'll say is that you can't rely totally on data science because you need client records for that to work, right? You need data to feed the machine learning algorithm. And so we're also focused on this population, about half of single adults who show up for prevention, who say, I'm at risk of becoming homeless, have no service record with anyone. This is the first time they're appearing for public assistance. They haven't been in the jail. They're not mentally ill. They're not a substance use disorder. They're not being treated for substance use disorder. Probably what we found in interviews is that they're suffering from a rapidly developing financial shock, and they have no personal safety net and often a lot of debt. And so how do you figure out, among all of those people who are going to identify that way, who is actually going to end up in your shelter or in your emergency housing system? And to do that, you really need a screening tool. You need a set of questions to try to figure out risk. And so we are working on a research project to empirically validate a screening survey that could be used to try to differentiate between who might be able to self-resolve, who needs lighter touch assistance, and who really does need that cash assistance and legal support to get over that hurdle. So that's just a little bit about what we're focused on in Los Angeles, and I'll turn it over to Tamika.
Thank you so much, Janie. And there's a lot there to come back to. So really excited about having this conversation. Tamika, thank you. Hi, welcome. So excited to hear from you. Could you just introduce yourself and tell us a little bit about what you're up to at All Home?
Sure. And Caroline, I actually have a slide show if I could have permission to share my screen. Hi, everyone. My name is Tamika Moss, and I am the founder and CEO of All Home. Janie, it's really a pleasure to see you. You are certainly one of the researchers giving us the tools that we need to do the work out there. So I appreciate very much your presentation. And Carolina, it's great to be a partner in crime with Turner Center. So I wanted to just walk you all through a little bit about All Home and the work we're doing in the Bay Area, and just to build on a couple of things that Janie talked about. We are, and maybe while I'm doing that, let me just share my screen so I can just walk folks through. Can you all see my screen? Okay.
Yep, we're all good.
All right, great. So All Home, we launched All Home about almost 2 years ago. And I had been working in the Bay Area, both in the public sector and the nonprofit sector for many years on housing, homelessness, um, poverty alleviation, public housing reform, et cetera. And what I really started to discover in my work experience was how disconnected our jurisdictions were from each other around figuring out how to support best practices, scale solutions that actually work, and really collaborate and align on efforts at the regional scale. So I've launched All Home really in service of being an organization that can bring the best work that's happening in the Bay Area and elevate that work to the regional scale. How do we disrupt the cycles of poverty and homelessness while, as Janie referenced, redress the racial disparities that exist within the people who are experiencing homelessness and housing insecurity? And I think the unique piece of the work also is bringing both the housing security approach with an economic security approach. In my perspective, they're inextricably linked, and All Home is really centered to focus on the intersection of housing security and economic security and mobility. The other piece of our work is really designed across all the 9-county Bay Area, bringing the various sectors and stakeholders together to advance solutions. So we work with the private sector, philanthropy, our community-based organizations, people with lived expertise in order to facilitate better outcomes for people who are experiencing a housing crisis. Um, I think it's important, as many of us have worked in this space for so long, and homelessness and housing insecurity has felt so intractable. And we believe that, in fact, it can be rare, brief, and non-recurring. And so we think it's really important to state that as we do our work across the region and across the state, frankly, so that as we're not intimidated by the solutions that actually need to be invested in and scaled if we believe that the problem is solvable in the first place. We also recognize the importance of, again, engaging stakeholders from across the entire spectrum of people who touch this work, that these are systemic issues, and in order to facilitate outcomes that help the folks that we see in our communities every day, we need to bring that collective approach across all sectors. And one last plug around how important it is to vision for the Bay Area that we want to see, one that actually supports an ecosystem for extremely low income people and people who are formerly homeless in the Bay Area. Not just treating folks as a problem to solve, but actually integrating folks into community. And therefore, the solution set for how to disrupt their housing crisis becomes a lot more abundant if you can imagine that they are integrated in your neighbors, in your communities. This is why we think it's important to do the work regionally. You know, so much of our work is managed in silos, and we talk about it all the time, but it's really hard to break out of those silos when you're doing the hard work every day, trying to support the programs that you're running and the people that you're serving. So All Home really exists to break up those silos and create an opportunity for that cross jurisdictional learning. Building consensus around the best solutions to invest in. We actually, as a former provider of someone who was working on family homelessness in San Francisco, we actually know a lot about what ends homelessness, at least bringing people into homes. What we know less about, I think, is providing economic and social stability for people to actually thrive in communities. And I think that's an opportunity that we have together. And then lastly, creating the regional, co-creating regional solutions is a part of the work, right? We are working on developing a regional homelessness prevention pilot in the Bay Area, really building on some of the work that Janie's doing, Beth Shin and many others. How do we use sort of the evidence and data that informs us around targeting the people who are most at risk of homelessness and putting our resources into the hands of those folks? And so each jurisdiction doing that on its own doesn't actually solve the problem. We need infrastructure at the regional level that allows solutions like prevention to be scaled. And that's what we're super excited about at All Home. I wanted to also just sort of center us around the importance of not just a commitment to racial equity, but recognizing the disparities that exist for the populations that we are serving. And so this slide just is an articulation of that. We often talk about our Black, Brown, and indigenous neighbors. The data is clear. And unless we are evaluating our programs, iterating on when in fact they are producing disparate impacts, we're not going to tackle the disparities in the way that is needed. And so I just wanted to ground folks in the commitment to racial equity, but also using the information around, how do you apply a racial equity lens to your programs and to the work that we're doing in order to see those disparities be reduced. Caroline, I imagine you talked a bit about this, but for us, many of us have been in this fight for a long time, and COVID really just sort of exacerbated what we all knew about the inequities that we're trying to tackle in the Bay Area. And I thought it was important to highlight this slide because when we talk about inflows, who are the folks who are extremely low income, who were barely holding on? And we talk about it as a math problem where you may be working 1 or 2 minimum wage jobs in the Bay Area, and you still do not have the income to meet your housing costs and your other basic needs. And so that's a math problem that the state of California and the Bay Area has. And so how do we think about that in the context of solutions to address homelessness? And then, I wanted to just highlight the perspective of the structural challenges that we're up against, right? Like, and I think Janie referenced this, structural racism isn't just about, our historic original sin of slavery and so forth. It's also about who has wealth, who has power, and who has the ability to influence the systems that they're a part of to produce better outcomes. And I think this is just a compelling reminder that, wealth and asset building, which has traditionally been the resource that most folks have used to get out of poverty and retain economic stability, this is a piece that has disparate impacts as well. And so that's just a little flavor of some of the things that we're doing, and I look forward to the conversation. I'm going to stop sharing now. Take it back.
Thank you, Tamika. So for those of you who have just joined us, unfortunately, Emily was not able to be here, so it's going to be a conversation between me and Janie and Tamika. We want to get to some solutions that have been emerging through the COVID crisis, but I'd like to actually stay with and focus first on this question of structural racism, because I think, Janie, your research is really powerful in understanding that it's not just even about sort of the larger systems that I think we are all sort of developing an awareness about, but even when we try and help, right? We see different outcomes for different groups of people. And so I wonder if you could tell us just a little bit more about that research, what that sort of points to in terms of where the points in our system of helping those who are unhoused, it may be broken or could be fixed. And then Tamika, I'd love to hear your perspective on that too.
Absolutely. So the research that I referenced is led by Professor Norita Milburn, who is one of our faculty affiliates here at the Department of School of Medicine, excuse me, at UCLA. And we felt that it was, first of all, we felt that it was crucially important that the research be mixed methods, because a lot of times when you're looking at data, you really don't see the why, right? So we consistently saw that Black clients as a group had higher rates of returning to homelessness. And by that, I mean, we could see them re-enrolling in shelters or other types of emergency services, even after they had been placed into a permanent supportive housing unit. But I don't think it was until we really sat down with clients and talked to them about their experiences and talked to providers and case managers that we really started to understand what was happening here. And I think there are a couple of key insights. One is that if you look at the history of federal and state funding for homelessness, people want to fund the housing unit. They want to fund the subsidy or the capital cost potentially of building permanent supportive housing. They may want to fund the services component, but they really don't want to fund the operating costs of our community-based providers. And I think you really have to understand how crucial those relationships are between the nonprofit that is delivering the program and their relationship to clients and the quality of services that they can provide to the client outcome. And I think we have to think more holistically about what it is we're doing when we provide homeless services. We are not just mechanically assigning someone a subsidy. There's a lot more that happens. And there are just some really interesting, this is like kind of in the weeds, but what the role that we call a case manager, that's the person whose job it is to go out and establish trust, to know that client's needs, to convince them to move into a shelter or move into a housing unit, to potentially help them once they're placed. At least in Los Angeles, that is not a career track position. So you're either, if you're really talented and good at that job, to advance and to earn more money, you're going to have to leave the roles of case managers and go do something else, so program supervision or whatever it is. So what you find happening is that there's a limited pool of talented case managers because lots of people have very rational incentives for not doing it. And you have this fight over people and wages, right? And the nonprofits that can pay higher wages are the ones that have access to more resources, right? And who have the ability to fundraise or, and so you can just see how these systemic issues trickle down and actually affect the people that we all want to be serving, right? If you're a nonprofit and you're trying to get to a place where you can even handle government contracts, or you're newer on the scene, you may not be able to pay the higher wage and get the best case managers, and then your clients are going to see more turnover potentially. So it's that kind of thing, really advocating in Sacramento and at the federal level to understand what it takes to provide high quality services, how to support our nonprofit partners in doing that, how to be realistic about the resources that they need, how to give them the workforce that they need. Lots of people want to talk about what it would take to double subsidies or double interim housing in Los Angeles, but who's going to do that? There has to be someone who actually takes that money and executes it. So, and then the other major structural issue is just the type of housing. So I think people think of permanent supportive housing as one monolithic intervention. It is, I think they imagine, unless you work in homeless services, you imagine an apartment and something on the supportive side, right? It's PSH, permanent supportive housing. So there's some kind of supportive services to help you, navigate your way into that apartment. The reality is that permanent supportive housing could be Section 8, it could be scattered site housing, it could be a project-based unit. In Los Angeles, it could also be a single room occupancy. You could be living in a room with a shared kitchen, with shared other facilities. And a lot of clients don't see those shared facilities as their permanent housing. They see it as an important stepping stone, and have the goal of leaving that setting and going into a less restrictive, more personal, and more independent living arrangement. And so it doesn't take a rocket science to understand that if you have a population based on where they are being served in the county and in their community that is being placed in that type of housing more disproportionately than other types of housing, that you're going to have more of those clients leave, right? And potentially some of them will fall back into homelessness. So that's the type of thing I think we need to pay attention to if we're going to be really serious about equity, and thinking about client outcomes. You didn't ask about this type of racism, but of course we also found examples of landlords saying, I'm not referring that client to that building, or a case manager saying, I'm not going to bother referring that client because they know the landlord will say no. That's happening too. And I don't want to ignore that. And to me, because I'm a former recovering lawyer, I immediately think like fair housing, and this is something that needs to be litigated and really investigated and audited probably. So that's also happening too, in addition to the structural issues.
Thank you. Yeah, and I think about that a lot, especially in supply constrained markets like Los Angeles and the Bay Area, where landlords have a lot of choice too to say no, and that you see that racism really come through. Tamika, I think especially given your experiences at Hamilton Families, right, like understanding these dynamics.
Yeah, no, and I, just a couple of additional points. I think it's really important to have cultural humility when we actually implement our programs and efforts, and really figuring out like, how do you listen to what people are telling you that they need when you're doing program design and when you're implementing programs. And if you hear that people are actually having negative impacts within your programs, that there's a willingness and an opportunity to change the way that the programs are being administered. And I think we do that by disaggregating our data by race, and we understand how program interventions are having disparate impacts if they are. And if they aren't, awesome, but that's usually not the case. And I think we don't have a mechanism by which we course correct in real time to assess what is actually producing the disparate outcomes and how do we address those. And I think coordinated entry is a really perfect example. Coordinated entry across this country has been implemented, certainly as a part of the HUD requirements, but I think in the Bay Area, in many jurisdictions where it focuses on the highest acuity and chronicity of homelessness, then you're sort of the funnel is already narrowed. And so some of the characteristics, and this is some of the research that Margot Cushell did in Oakland, right, where you realize that in fact folks did not have mental health and substance abuse issue, Black folks in particular. And so they were scoring low on the coordinated entry assessment tool, when in fact their housing needs were appropriate for, a housing intervention. So I think it's really understanding what is actually going on for specific communities, and having some humility around designing and making adjustments to your programs and interventions that address some of those issues. I guess the only other thing I would offer is that there is clearly something wrong when you look at the data where you have, and I'll use the classic example, 37% of the population of folks experiencing homelessness in San Francisco are African American, and the general population is less than 5%. Like that there's clearly something broken there, and that is across the entire spectrum. And so it's not just San Francisco, it's every community in the Bay Area has very similar demographics like that. And so I guess from my perspective, it's most helpful to not ask the why, but it's it's not to be like, holy crap, can you believe that is happening? The answer is yes. So let us do what is necessary to actually target those disparities and reduce them. And that is, I think, the challenge that we have, is that we sit in awe of them and we lament about them, but we aren't necessarily going back into our structures and systems and figuring out how to shift those outcomes.
I was even thinking as both of you were talking, right? Like one of the problems is that those case managers are also underpaid and are also more likely to be people of color and are also more likely to be precarious in their housing situation themselves, right? And so we sort of see that through the entire system. And until we start addressing the labor market side and what we value and what we pay for,
Exactly.
we're going to continue seeing people housing insecure. Tamika, you said something about sort of correcting in real time. I feel like in the homelessness space, we have been innovating in real time, trying to respond to the COVID crisis and making sure that our unhoused neighbors don't stay unhoused during this pandemic. Can you maybe start and talk a little bit about what you've seen emerge from the COVID-19 crisis and what you think some of those lessons are, or some best practices that we could hold on to even as we emerge out of the crisis?
Well, my mind goes to the state's efforts to rapidly respond to bringing our unhoused neighbors indoors, and really decentralizing the shelter systems through Project Room Key and Home Key. And I think it was opportunistic to be able to use vacant hotels that were impacted by the economic recession of COVID, and bringing unhoused folks inside and providing the services that folks needed. And I think, I think folks understood, like, the urgency for the first time in a while. Like, I feel like we've been talking about how urgent homelessness is and the housing crisis, but after COVID hit, we somehow unlocked our ability to acquire temporary interim housing, and bring people inside quickly, and prioritize both their health impacts as well as the other social service needs that they had. And so one of the lessons learned for me was, we actually know how to do this. If we have the political will to remove the regulatory barriers, to partner with our jurisdictions, and to bring money to the table, then we can innovate in ways that actually gets us closer to scale relative to the number of our neighbors who are unhoused. So that to me was kind of a light bulb. It was like, wow, the state got behind this. They figured out partnerships with philanthropy. And Janie talked about this around our propensity to invest in capital, but then we don't invest in operations and services. It's like, I often say, it's like building the house without the windows and the doors. And that's public policy writ large. Like, that's a fundamental structural problem, in my opinion. And I thought that, it was interesting that the state was able to bring philanthropy in to partner with them on covering some of those service and operations costs. So I thought that that was a helpful intervention in terms of, bringing folks in quickly, getting them safe, and then being able to provide the supports that people needed. So really thinking about, how do we make some of those things permanent? How do we maintain the same level of urgency that allowed 15,000 folks to be brought in within 3 months? How do we do that across our region and our state? And then I think for Home Key, which is, how do we acquire these properties permanently and convert them into permanent housing? I mean, that's a acquisition rehab strategy that we need to scale. Like, we need to be as creative as we can around housing typologies, modular. Like, how do we get creative around the things that we know can be acquired quickly and cheaply, and go for it, go gangbusters. Remove the political barriers that impede us from being able to act quickly. So I think it was a glimpse of hope that when there is political will, resources, then creativity and options open up. So I would love to see how we can keep those roads clear and make some of the barrier removal permanent.
Thank you. Janie, do you want to weigh in too? I don't know if there's things in Los Angeles that are happening that would be valuable for us Bay Area centric folks to hear about too.
Well, I was gonna have largely the same answer. It's just remarkable what we can achieve when it's urgent and resourced and everyone is focused on it. So was gonna say the exact same thing. I hope that we now have some muscle memory that we can use to stay focused and I saw it play out in large ways, meaning the acquisition of hotel motels, the rapid moving of clients off the street, or decompressing shelters. So we can move people when we need to. But I also saw it in small ways, like brokering new innovative ways to get clients document ready, meaning how do you get the information you need to establish a person's identity and eligibility when it had to be done fast. It turns out there's lots of solutions. And a lot of those solutions just require lawyers giving you the right answer, right? So like, there was just lots of, I think, positive stories on just doing the work quickly. The only other thing I would add is that I feel like there's a need to sort of document and understand the expansion of telemedicine and what worked well and what didn't work well and what could be scaled for a very vulnerable population. It's very hard to have a very vulnerable, particularly unsheltered population, have adherence to medication, to get access to it, to get access to primary care, mental health services. And I suspect that if someone focused on documenting what happened and what the pros and cons were, you'd probably have some really interesting findings where expansion of telemedicine provided big benefits, and then in other contexts and for certain issues where it didn't work as well. And I just think it would be a really important thing to pay attention to in the future.
Can I add one more that came to mind as you were talking, which is, the effectiveness of direct cash assistance, right? Like we actually saw when the very first stimulus package and the former president put out $600 or whatever that was, plus supported unemployment benefits, we actually saw that fewer people lost their housing, that people actually used the money to pay the rent. And so this notion that, people with low incomes are irresponsible with their money, I think is a myth. And we need to not be so paternalistic and trust that if folks had the resources, they know what to do with them. And I thought that that was really insightful, both from the stimulus, and I see, of course, Congress has approved the second round, but also through the work of Mayor Tubbs in Stockton, right? In the pilot, I think research is starting to come out, but I just wanted to lift that up because I feel like, again, on that economic security piece, we need to be looking at, income supports that actually help people stay housed as well.
Yeah, and I would add on to that, right? Like I feel like we're finally breaking down the myth that government isn't the solution and that government can't tackle these problems, and that there is a role for the federal government to support households who are structurally vulnerable, and that those investments are worth it, right? Both in the short term and in the long term.
Absolutely.
So I'm going to start opening it up to audience questions. So if you have questions, please put them in the Q&A. One, Janie, there's some requests that for you to share the link to where the California Policy Lab studies are located, and particularly the one around first-time homelessness and their history of receiving mental health services. And then there's a question here, which again goes to sort of these emergency responses that we're seeing, and this idea of sort of these co-governed encampments as a supportive housing intervention strategy. Any research about their effectiveness, Tamika? Any sort of thoughts about where they fit in the continuum of approaches that we should be thinking about as we're addressing the people who are currently unhoused?
Janie, did you want to?
No, I have to confess that I have not studied co-governed encampments. I don't feel qualified to take that question. So I might have to defer to you on that.
Yeah, I mean, I I'm conflicted around um, sanctioned encampments, and I think part of it is because I feel like the Bay Area, the state of California, in its percentage of people who are unhoused, has somehow normalized that it is okay to have people degrade on our streets in encampments until we have enough housing for everyone. And I just fundamentally disagree with that position. And so if we have encampments because we don't have enough housing for everyone, I understand the need for sanitation services. When I was the chief of staff in Oakland, we'd spend a lot of time thinking about how do we keep people as safe as possible when they're outdoors. But I think by creating an infrastructure that institutionalizes encampments as a housing option is undermining the fact that we in fact need to be intolerant of the fact that so many of our neighbors are unhoused. And we need to be applying that same sense of urgency that COVID brought to us to the set of solutions that we need to employ. And from my perspective, and All Home has really been looking at a flow model, right? Where it's not just about bringing folks into interim housing, whatever that is. If it's a navigation center, a camp, or a cabin community, what voucher, whatever that is, that's a temporary solution. We need to subsequently and in parallel be investing in prevention as well as permanent exits. So if we actually do those things in concert, and we are actually tracking people who come into our systems and placing them in the appropriate interventions that resolve their housing crisis the fastest, that to me is how you respond to the unsheltered housing crisis. You can It is challenging for me to endorse the sort of governed encampment strategy when I think the real goal should be how do we deploy our resources and housing options as quickly as possible to keep people safe.
Yeah, thank you for that. I think that that's important. And also, as you said, right, we don't want to normalize having people live in encampments because we don't need to. We have solutions,
We do.
right?
We do.
And so I think this question, or there's sort of a set of questions around sort of how do we leverage data better to be able to understand both the problem, but also to sort of target our interventions most effectively. I think one question is, how do we even know what's happening given that the fact that the point in time counts have been suspended because of COVID? Are there other ways that cities can find and, sort of do a better job of tracking data and understanding who is at risk? And Janie, maybe you could talk a little bit more about the screening tool that you are all developing.
Yeah, so I guess I'll talk briefly about both of those topics. There's a lot of interest naturally on what data do we have that could give us a sense of what's happening in the absence of a PIT count. And we think a lot about that question, specifically the question of what does the administrative data MLA tell us and what does it not tell us, so that we don't get into trouble making assumptions. I think fundamentally the problem with administrative data is that it is a reflection of who we are serving. And every time we serve a person and we know that they are homeless, it might get flagged, by a hospital worker or someone who's, working on CalWORKs enrollment or CalFresh enrollment, or obviously in the homeless management information system. But all of those are reflections of people who are attached to a system being served. So we really, in a state where there are so many unsheltered individuals who are entirely disconnected from services, we have to be really careful not to substitute that data for the PIT count, because you're going to see populations get missed. So to be a little bit more specific, we just recently explored this question and we looked at, could the data on street outreach services in Los Angeles be a substitute in some ways for understanding the unsheltered population in a year where there isn't a PIT count? There are 37,000 clients in 1 year who are enrolled in street outreach services. Street outreach services are teams of people who go out and engage with people who are specifically on the street in Los Angeles. And the goal is to connect them to services, a variety of services, including street medicine and housing. And we ran just a basic demographic analysis of that population and compared it to the PIT population. They're not hugely dissimilar, but you see something that I see in other studies as well, where the street outreach population, if you just relied on that, would undercount particularly our Latinx or Hispanic population in LA, and would probably undercount the lower acuity or less vulnerable people, because as you might imagine, street outreach is prioritizing people who appear to be more in crisis or more sick. So it's not to say that these data aren't valuable. They're enormously valuable, and they're hugely underutilized, in my opinion, for generating insights about the effectiveness of programs and people's housing trajectories and what do we know about the unsheltered population. But they're not, I would just caution that they're not totally a substitute for the PIT count. You know, the other thing that we're going to do, and probably other researchers will do, is really look at inflows to services. So I mentioned that admin data is a reflection of who we're serving. We can obviously go back and do time series analyses of who we're serving. So does it look different, you know, this year than it did in years past? So I think a lot of potential. I would say in general, administrative data is underutilized, and we should have lots of people looking at it and working on it and exploring solutions. The second question was, you know, what is the screening tool? Los Angeles uses a tool that they call the prevention targeting tool. It was developed in collaboration, I believe, with Apt Associates and maybe some others. There was no template really for this. So I think they did the best they could looking at all of the literature available on risk factors for homelessness, and they came up with a survey. It operates a lot like the VI SPDAT, if you're familiar with that, where you ask questions, you get points, and then your points add up. And then if you cross a certain number, you're eligible for one-time cash assistance, typically some case management and attachment or referral to legal aid, because a lot of people who are at risk of homelessness have very urgent legal issues, either related to their housing or employment or other. So the problem with screening tools, I would say, including the VI SPDAT, is that they are typically not empirically validated. No one's gone back and sort of scientifically tried to correlate the questions to the outcome that we care about, and really think about, could it be shorter? Could it be more predictive if it had different questions? So that's what we're trying to do, and we expect to have results later this spring. We're looking at each of the individual questions to see if they predict homelessness, and also the total score. And I think fortunately in Los Angeles, you can do this because there are enough people who've received prevention that there's a sample large enough to do some of the analysis that we would like to do. I think anytime you're talking about a screening tool and it being validated, I think I would say as a researcher that this will be hopefully better in Los Angeles. I would caution against assuming it would work exactly in a different community the way that it does in LA. But sometimes I've also worked in government for many years, so I know sometimes like you can't let the perfect be the enemy of the good, and you just want to use the thing out there that's has the most evidence behind it. So that's what we're doing. We're also, by the way, doing a mixed methods approach to this, where we're reviewing the questions for cultural sensitivity and interpretability, which I find is often a step that people don't have time to take when they're trying to administer a program. You work at a public agency, you've got to get the money out the door, you need an eligibility process. You don't have time to think about whether every question is worded in a way that a client can understand. It turns out that we're learning in interviews that some of these questions, people have no idea what we're trying to ask them. They literally have no idea what you're asking them. And so that's not good. You know, if that information is predictive and they don't even understand the question, then you really need to reword it. So we're hoping that will be useful too, potentially if you want to ask those questions, but also just as an example of how to do that kind of research, you know, relatively quickly on a small scale and hopefully get a better screening tool.
I was thinking about a survey that we did of residents living in affordable housing. And when we asked them about their experiences living in affordable housing, they were like, well, what's affordable housing, right? Like we think we know what the terms are, and in fact, they're not at all what people are experiencing.
Yeah, yeah. In a similar vein, one of the questions, as you might imagine, is, are you doubled up? No one knows what you mean by saying doubled up. It's just a term we all use all the time that turns out like doesn't have common meaning. And there's a question on the VI Spit at that's basically asking you, have you ever had to leave housing due to a health condition that you have? And it's meant to be asking, have you had a physical disability that affected your ability to pay your rent? Everyone thinks that you're asking whether your housing made you unhealthy. Like, did it cause you, basically like allergies or chronic illness because of the quality of it? So these things matter. You have to pay attention.
Yeah, thank you. Tamika, were you going to jump in with a follow-up?
Well, I was actually going to go a different angle with this question and talk a little bit about the incongruence between how people interpret data and how they perceive the problem. So, you basically have these mental models about folks who think they know. I mean, I think Janie actually led with this when she was like, the whole myth that people come to California to be homeless. And no matter how much we say there is data that completely dispels that, people repeat it and it is their truth. And so there's something about how do we use data in a way that shifts people's mental models and using it almost as a tool of storytelling that helps people pull back from their own perceptions of what it is that's going to fix the problem and allows people who are actually trying to use evidence-based information research to inform our practices and efficacy of the work we're doing. And how does that not collide? Because I find that the environment is so riddled with folks having compassion and empathy and wanting, just plain speak solutions. Like, why can't we just, turn that school into a housing spot? And how do we, it should just be this. And I think it would be interesting to use data as a tool to help evolve the public narrative around how people perceive people who are unhoused and what the solutions really are.
Yeah, and I think that storytelling and the degree of stigmatization that happens among people who are unsheltered or unhoused, and there's a question that refers to that in the Q&A about right residents of neighborhoods attacking encampments or being really opposed to encampments. And I think a lot of that has to do with the fact that we don't see them as neighbors, right? We are stigmatizing them. And I think the work that you're doing, Janie, is really valuable in sort of saying, no, it's by being unhoused that we see these mental health conditions emerge. And I think, Tamika, your work is similarly trying to sort of unpack some of those narratives and stigmatization.
Yeah, and try to articulate who we're really talking about. When I was at Hamilton, we had families who were 50% of the families that we worked with who were experiencing homelessness were employed. They were healthcare workers, they were teachers' aides, they were all of the extremely low income jobs that they have access to. They were already occupying. So, this notion that you're not working hard enough and work is the answer. I mean, again, I think we just have to challenge our thinking around what's really going on and how do we tell the truth about the math problem in the Bay Area, where you actually have 1-bedroom apartments going for, well, in the pandemic era, it's a little bit different, but $3,000 a month. I mean, you on average across the entire Bay Area. So I think homelessness gets scapegoated to avoid the other affordability and economic exclusion challenges that the Bay Area produces. And I think we have to be courageous to have those conversations and try to connect the dots for people that this is actually a symptom of those bigger, you know, um, forces that folks are sort of the tip of the spear for.
Yeah, and then
If I could just add to that really quickly, I wanted to pause on that employment point for a moment. We took 10 years worth of HMIS data and looked at clients who enrolled in services in LA for the first time. So the first time they enrolled in a service, and we linked those individuals to state wage records. So we really wanted a more empirical accounting of how many people who are homeless have a wage history in California, and how recently were they working. And the results were fascinating because something like 75% of the homeless population had a wage record in California. And that's obviously an undercount of employment because this is state recorded wages covered by unemployment insurance. We're not talking about cash for hire or gig work. So it reinforces the point they're from California. Many of them have a work history. 37% of these people, and these are including single adults, were working within 2 years of becoming homeless, and close to 20% were working while they were homeless. And the number was quite a bit higher for families, as you pointed out. And it's just so important, I think, for reframing people's perceptions of the homeless population. The flip side to that is that the average wages for individuals seeking homeless services was less than $10,000 a year.
Exactly.
You know, and those are the portion of people who are working, right? But like that's unthinkable,
Yeah.
for anyone to be trying to subsist on those wages. And just to draw this back to the prevention point, and then I'll stop. But when people ask me, I've had many conversations in the Bay Area or Sacramento and LA, you know, like, your research isn't done yet around this screening tool. I want to set eligibility criteria for this prevention program. What should I do? You know, like how do I target this program? It's such a common and urgent question. And I wish I had a better answer, honestly, but I always start my answer by saying, you have to set the area median income at 30% or lower. You know, like we have to understand how low the income is for people who end up experiencing homelessness. And what ends up happening is that there's a policy conversation after that around, oh my gosh, what if we can't find the right people? Or what if we feel left out? Or we want the flexibility to give assistance to families we know who need it. And then the AMI threshold is at 80%, right?
Exactly.
And so we really have to understand the problem and where to send the resources and how low people's income is who experience this outcome of actually being on shelter or homeless in our system. We have to adjust our thinking about how deeply poor this population is.
Well, and in some of the research that I've done of residents who actually are living in subsidized housing and who are working, I track their income over a 15-year time period. And if they're making less than $20,000, they're not making more than $20,000 15 years later, right? They are stuck in those very low wage jobs. And they're never going to be able to make it on the private market, given how expensive housing is. And I think there's two questions that I sort of want to address. One is, again, coming back to these questions around sort of basic minimum income and just putting money in people's pockets. And there's a question asking sort of how much are these refundable childcare credits, tax credits happening right now? How much of a difference are they going to make for the problem of homelessness? Do we have any estimates of that?
I don't. I also feel reluctant to opine about safety net impacts with Hillary Hoynes on the conference. We do have colleagues at the California Policy Lab, including Hillary and others, who have done a lot of work on EITC and in particular a focus on who's actually applying for and able to take advantage of the EITC. There's a lot of families who would qualify and be eligible who are not taking advantage of it. The one thing I will say is that it's remarkable that small amounts of assistance can be definitively change a person's trajectory. When we interview clients who have fallen into homelessness, it's a $500 unpaid utility bill. It is 1 month's rent. It is a broken down car that made them lose wages for 2 weeks. I mean, people are extremely good at managing their money, right? They understand down to the dollar what is happening in their household typically, and the margin is very small. And so I can't say this because this is not my area of research and it hasn't been studied yet, but my hunch is that it will be hugely important to a very large number of families. And I hope someone will study the impacts, not just on family stability and income, but on homelessness outcomes as well.
Yeah, I mean, I can just, speak anecdotally to the families that we worked with who experience childcare issues while trying to work, while trying to find housing and so forth. And I think it's again this notion that people live their lives somehow segmented, right? Y- childcare is a part of your family costs. And if that is mitigated by resources that come from the government or whomever, that's going to inherently free up resources to go elsewhere. And so I actually appreciate that we're thinking about, child care subsidies and other, interventions that are going to transportation subsidy. I mean, how do we think about the whole ecosystem of a family and their costs, and when they're experiencing an 80% rent burden, there isn't a lot of money for anything else. So don't know how this pot of funding is going to help, but I like Janie, I imagine this people are appreciative and are going to put it to good use.
So there's another question that is asking us to sort of reflect upon what's going to happen post-COVID, right? What is the degree of housing insecurity that we might see? What is the impact going to be on homelessness? I know it's hard to have a crystal ball, but before I give my thoughts, do either of you have sort of a sense of what we might be seeing in the coming couple of years?
I'll respond, and I'd be curious what you think as well. So there were a couple of studies that tried to do rough estimates potentially of the increase of inflows to homelessness. One comes to mind from Dan O'Flaherty at Columbia. Another one I think was done actually at UCLA. And I remember the range between them was something like a 40 to 60% increase. This was months ago. And so they certainly wouldn't have accounted for the federal legislation that passed this week, and other types of assistance and or anything the state might be contemplating doing around rental arrears, utility debt forgiveness, water debt forgiveness, policies that could actually impact this. My expectation is that we will see a large inflow that's partly informed by work we've done separately from our homelessness work that's just looking at unemployment insurance claims in the wake of the pandemic, and that work is available on our website. But the sheer impact on lower wage workers and communities of color and high poverty communities, it's staggering how many more people are out of work or underemployed. The estimates of people who are unemployed who are not able to access UI are really heartbreaking, and it just feels to me inevitable that will push down on our most vulnerable people, and the most extreme final outcome is becoming unsheltered or homeless. So we don't know. I think at least in Los Angeles, in the policy conversations we're having, we're bracing ourselves. That's why we're working day and night to try to finish the screening tool for prevention. If we have the opportunity to see a major infusion of prevention assistance, how can we operationalize it quickly? How can we work at the system level, and in Sacramento to argue for some of these broader scale policy interventions? It's hard to say exactly how big it will be, but people are expecting it to be a big increase over, the steady state increase that we've seen in years prior to the pandemic.
Yeah, I concur. I mean, I feel like the state's rental assistance program that is driven around SB 91. I think we need to be thinking about. We should anticipate that it's going to be high, and then reverse engineer, work backwards for the ways that we mitigate the harm that compression is going to have. And I've been saying this since the beginning of the pandemic. You already had folks who were barely subsisting, and then you put the burden of this economic and health crisis on their backs, literally. And then when we have rental assistance programs that aren't targeting that 0 to 30% AMI tenant population, then inherently you're going to have folks falling into homelessness much faster than pre-pandemic numbers. And so I think it's really important to tie the rental assistance resources that are coming in. And I think we saw this in the second wave of funding before the new package passed, that there was a cap, at least 80% AMI cap on the rental assistance dollars. The first round of CARES funding did not have that. You saw jurisdictions doing lotteries and random, because everybody's hurting. And somehow, getting all those resources out is onerous on the cities and counties. I get it. And we know that the folks who need it the most are the ones that are actually going to stay housed if they get those rental assistance dollars. So I think it's going to be really important for us to look at infrastructure while all this money is flowing. What do our community-based organizations need to actually support folks to stay in their housing? What do our legal assistance folks need to ensure that when the eviction moratorium lifts, that those folks are not at the tip of the spear for evictions? What do we need, right? So how do we walk and chew gum at the same time, recognizing that the wave is coming and doing what we can to put protections in place for our most vulnerable people? And I think if we can do that and leverage the resources coming in to create some of that safety net, then we're going to have less folks who are vulnerable.
I think that's one of my biggest concerns, given the research that I've done coming out of the foreclosure crisis, is that we knew foreclosures were hitting Black and brown borrowers and neighborhoods well before the federal government started paying attention. And my concern is that we're gonna solve it for the majority of Americans, and then we're gonna stop paying attention to those for whom the recession is really going to be longstanding. And certainly the eviction moratoria are really critical. The rental assistance has been really critical. But when all of those end, the people who are going to be most vulnerable to eviction, and I'm guessing here, right, are those who are in rent-controlled apartments where the landlord is very eager to have that apartment emptied so that they can re-let it at a higher rate. And right, like if we're not paying attention to that now, by the time we actually see it in the data, it's going to be too late to do anything about it.
And the other vulnerable group are the people who were doubled and tripled up. So let's say they got jobs back in during the recession. Those jobs still are not enough, right, for them to move out into their own places. So all of those households who have double, tripled, and quadrupled people in the households, those folks are very vulnerable post-COVID to eviction.
Well, go ahead, Jenny. Sorry.
I just wanted to make one quick point about the unique nature of this economic crisis. So there have been recessions in the past that teach us lessons about what happens in the labor market. And I'm oversimplifying, but generally, if you have a recession like the one in 2008, you see job losses sort of penetrate down into different categories, right? So like workers of one income level move to lower wage jobs. Those workers are moving to lower wage jobs. So you kind of get the story of like the engineer working at Starbucks kind of thing. And I think one thing that's really important to understand is that we saw a whole sector of employment disappear temporarily, right? So many of our low wage service jobs, no one was working in them, right? And that's going to have a very dramatic effect on the bottom of that tier that I'm describing, where those people would get pushed out. They're getting pushed out at much higher numbers. And so it's going to require a different way of thinking about recessions and unemployment, I think, not just to mitigate the homelessness crisis, but to make sure we don't have like a generation of people locked into poverty as a result of what happened.
You're kind of reminding me, Janie, of sort of what happened in Oakland, right? Where the compression on the housing market that was naturally affordable for regular old folks who were paying $600, $800, $900 a month for their housing, when the influx of higher wage earners came into Oakland and started taking over that naturally occurring affordable housing, there was really nowhere for the folks who were in those units to go. And that's why we saw a 50% increase in homelessness within 2 years. And those very folks were housed just 2 years prior. So I think that's a really good point about the employment, but also on the housing side, that same effect is happening in communities across the Bay.
I've also been thinking about it on the context of homeownership, because we're not going
Yeah,
to likely see the same foreclosures as we did. And so then we're like, oh, well, that's not a problem. But
yeah,
if low income homeowners of color are being forced to sell their house because they can't afford to pay their mortgages, right? Yeah, they might not be in foreclosure, but they're still going to lose their home. And I think Margot Koshel's research has shown that those homes are also really important anchors for extended families, right? And so then that housing is lost to those families and their extended networks of care. There's a few questions that sort of center on this question of homeowner communities, homeowners, higher, wealthier neighborhoods being really resistant to being part of the solution, and wondering how they can be part of the solution, right? What can higher income homeowners, cities, neighborhoods do to respond to the homelessness crisis? And are there solutions that they can get behind and be a part of?
One whole area I think of advocacy or involvement is following state and local legislation and being an active member of helping educate your local and state officials. The United Way of Los Angeles is a great resource to understand sort of upcoming legislative battles. They're not the only one, but it can be hard to track every individual bill that feels important. So going to larger advocacy organizations like the United Way, the National Alliance to End Homelessness, and similar organizations to just be an active participant in pushing for many of the policies that have been mentioned, including ones that were mentioned in the first panel around zoning, making affordable housing more possible, all of the policies that are needed at the housing level. On homeless services, there are a couple of simple things that I always really advocate for, which is have a personal relationship with the provider in your area. Los Angeles, at least, is a very big county, and so homeless services happens at smaller geographic units, either cities within the county or what they call a service provision area. And there's a lead agency for each service provision area that's in charge of adults, families, and youth. And I always recommend just understand which nonprofit is the lead agency. What do they need? What are their clients like? How do you what to do when you see an encampment or an unsheltered person? There is a portal to report that information that's helpful to people who might be responding to that. So just that's a very baseline thing. It might be something people have already done if they're on this panel and interested in this issue in the first place. But I found, even living in Hollywood and now in Burbank, I know my nonprofit and I know what they need and what their fundraising goals are and what their challenges are. And I feel like it gives me a better sense of what's happening, in my own neighborhood. And then I think having, if you are a person of privilege who has means and friends who have means, creating a space to have informal personal conversations with those people about homelessness, and to do some of what Tamika said about just take the data and try to build a slightly different narrative than what they might be thinking in their head, in the absence of any concrete information. So I'll talk to Rotary clubs, I'll talk to anyone really, business councils, people who don't normally think about this issue, just to try to ground people in a common set of facts. But I also do that in my personal life with other parents, with other people, in my social network. Whenever people ask, I really take those questions very seriously and try to just engage at that level too. So that's kind of big and small. There's like the big state legislation, and then there's small personal relationships, like person by person, really trying to change the way people think about the issue.
yeah. No, I'd say ditto to everything you just said. Only to add that, this theme that we've been talking about, that somehow unhoused folks are not our neighbors, and that we don't have a mutual responsibility to being okay with helping them get housing. And one of the biggest obstacles that we see in communities across this entire state is the opposition of actually building housing for people. That actually is undermining any effort, your whatever charitable giving you give to an organization of your choice, whoever you see on, if we do not have enough homes for people, full stop, we are never going to be able to bring everyone inside and into security and dignity. And so I think it's really important for folks to have empathy on a human level, recognizing that these are mothers and daughters and sons and brothers and cousins, but also to actively oppose housing in your community undermines our ability to really tackle this crisis. And so I think say yes to housing, a duplex, a triplex, multifamily, interim housing that brings people inside. Say yes. That is actually what we need to get at the foundational challenge that we're struggling with. I think the other piece I would just say is um, homelessness is, I think we often think about it as a charitable act as opposed to the our systematic failures are actually causing the experience that many folks are having. So being just open to shifting the responsibility from the individual to the broader set of factors that are at play that are both visible and not, that are contributing to this crisis, I think it's really important. Just, use the data. Look, there's lots of information out there that can round out people's natural perspective, perceptions and such, and it creates a little bit of dimension in how we think about this issue.
Thank you. Thank you both. We are coming up at time, so I'm going to ask you each to for some closing thoughts and maybe also providing the audience with direction as to where they might be able to find out more about All Home or California Policy Lab, and then I'll close us out.
You want to go first?
Sure. So first of all, thank you so much for joining us. It is a Friday evening and folks are still on the Zoom listening to us talk. So I am grateful for that. It means that you are in it and you care, and I appreciate that very much. My closing remarks is just to leave this conversation hopeful. There are actually efforts across the state and across the region that are working, that give us evidence that solving the housing crisis for people who are unhoused is possible, and that if we do it together, we have much more impact. And so don't leave this conversation seeing folks who are in crisis as a victim. Folks are resilient. People want to participate in their own life success. And so how do we create opportunities for that to happen? And I am, All Home's work is really trying to shift some of these mental models and paradigms using our research and evidence to elevate solutions and scale them. So do check us out at allhomeca.org. We're doing some really great things in partnership with the folks on this call. And we want people to be a part of the conversation, because we think that if we're going to tackle this issue once and for all, everybody has a role to play. So thank you so much for letting me be a part of this.
Well, thank you for me too. I'll be brief because I think I might be the last thing standing between all of you and your Friday afternoon cocktail or whatever it is you do at the end of the week. But you can find out more about our work at capolicylab.org. And most of what I talked about today is available there in a paper, except the one thing that Chris Ware asked for, which is the 10% statistic on mentally ill individual or access to public mental health services. That's something that we did as part of our predicting and preventing homelessness paper, but I don't think it's in there. So Chris, I'm happy to follow up with you if you're still online about that data point. But I love ending on a hopeful note. I would totally agree. We do know how to solve this problem. And one of the last commenters asked, people are so frustrated. They see massive amounts of tax dollars going to this. They don't see any progress. They expected to see fewer unsheltered individuals. And what I would say in response to that is that we know the solution, we know how to do this, we know it works. the scale at which we have to operate is much larger than we've had the courage to do yet. And that's true at the federal, state, and local level. We know that what it is, but we've got to do it much bigger and much faster. And so advocating for that type of thinking, I think, would be, really effective if you're a concerned citizen. So with that, I will turn it back over to you, Carolina, and thank you for having me.
Thank you both. You are both my inspiration, Tamika with your policy practitioner brilliance, and Janie with your research brilliance. It was an absolute pleasure to be with you guys. That's it. I'd like to close out by thanking Joseph Broadus and Hillary Hoynes for putting on this amazing event, and also the Smith Richardson Foundation for providing the support to allow us to all be here and share these thoughts with you today. Everybody, thank you for joining us, and yeah, have a terrific weekend.
Thank you.